understand that COVID has given created a situation where a large number of healthcare requirement is generated, just and that has parallelly increased, just because the world in India there is a scarcity and there is a global scarcity also. So with that, if but that scarcity doesn't mean that even if you are not polished, you can go there, because there are, every country has their own examination pattern, testing pattern, interview patterns, and then you have to crack them. uh, to get to that level, you need to have rigorous uh, polish and rigorous standards. And there is an exam for going abroad, especially in US, UK, that's called OET, Occupational English Test, conducted by Cambridge University Press. That exam pass percentage is about 7% only, and that too with people with 7-8 years of experience are not able to pass, even when they are giving exams several times a year. And the cost of exam is very, very costly. Then why people are not able to clear those exams? Because it's not giving exam about nursing, because it's the kind of professional understanding of professional English, medical English, that you have to pass, which is not being taught here in India. So you need to assess that how you can, and it is not just that exam which is important. It is that, do you know, even in good hospitals in India, you talk about Apollo Group, or you talk about Max Group or Fortis Group, they also require, because they have international patients coming to them, so they also want to nurses to have that kind of level. So we all understand that there, yes, there is a great scarcity of nurses. So this becomes a very, very good opportunity for all those professionals who are working in this domain to polish themselves and get benefit out of it. So if you are not in the top 10% bracket and polishing yourself, you will lose the opportunity. So and a 5.9 million nurses scarcity is a very, very huge amount, and India is the country where everybody else is looking forward. All is required is that you need to have that capability. Now, these are certain recommendations. I will not talk about recommendations in general, because all countries are working and focusing on that, how they can increase their workforce, how they can improve upon, and every country, including India, is setting up more and more colleges, setting up more training programs for nurses. But I would say that creating of more talent workforce is one thing, but another thing is that how well we are prepared and trying to make our nurses productive from day one. So day one productivity and effectiveness should be the goal. One important thing is this, that no hospital in today's environment has time to train nurses, and no hospital has time to tell the process, system, procedures, and guidelines, records. So they expect nurses, those who join them, that they are quite aware about, and they can be deployed from day one, because there's a huge pressure on them. Now, are you day one deployable? Are you ready from day one? Are you resourceful from day one? Can you be productive from instantly? So these are very important things to understand. So there are a couple of factors which require nursing education to improve upon. I'll talk more about. So this is a very important. Just two more slides I will talk about. The Center for Continuing Nursing Excellence conducts a very unique program that is called NEEP, that is Nursing Employability Excellence Program. This is what I'm talking about, is this NEEP program. This is Nursing Employability Excellence Program. This particular program objective is to train and quality nurses. So even if you are a graduate nurse or a postgraduate nurse, you can be converted into a more result oriented nurse, an excellent nurse, a nurse which has the capability of providing deployability from day one, is also aware about the legal and ethical issues, is good in documentation and information systems, understand protocols, evaluation, and basically understand nitty gritties of the work environment. It is expected that you are already aware about all the process, system, procedures which has been taught at you at the graduate and postgraduate level. The objective is to know how well you can communicate. Do you have the way to communicate of reading, writing, listening, speaking skills, and that too in English? You know the medical terminologies very well. Do you know that you have the leadership skills? Can you communicate with the other stakeholders? So that's the program all about. And there are several features, is like polishing of the basic communication skills, preparation. So don't take it that this is just improvement of your English skills. It is the overall polishing of a nurse. It is based on a concept which is called CEFR, which is developed by European Commission, and it is all about a standard framework, that how you, it tests you first and then tells you where you stand. So like a doctor first prescribes a test to a patient, that let's do your blood test and find that what is your current level of blood sugar or cholesterol or like that. So similarly, a test is being conducted in CEFR, and that test tells that what level you stand. So it is basically A0, A1, A2. These are the levels, B1, B2. It goes up to C1 and C2. C2 is somebody who is an expert. It doesn't require, he is the topmost level. And A0 is who is at that bottom level and who requires thorough brushing and is lack in communication. So this is not just the basic English. This is basically the medical terms and medical terminologies which are being included in such a way that it's help you to understand where are you and how do you can become and even give and pass the OET exam, that is occupational English test, which you may take or you may not take. But at the end of the day, the objective is to test yourself and find that are you polished enough, and are you polished enough to take the next level in the nursing domain. So these are levels, different levels of the program. So NEEP erudite, NEEP elevator, NEEP excel, NEEP empower. So when is this CEFR, and based on that there is nothing called pass or fail. You may be less than A1 or you are in A1 or A2. If you are below this, that means you have to start from level 1, and then you have to go to this level, then you have to go to this level, and then you have to. So ultimate aim is to clear minimum standard B1, so that if you are a minimum B1 standard, that means you are capable of, now you understand that you can train yourself to the next level, which is you, after that you can give an OET exam and go abroad, and even that. But first you need to understand where do you stand here. If you are in this bracket, that means even you are not good for Indian hospital or healthcare setup, not good for that. You are, I would say you are at the bottom 10%. If you are at this level, you are at bottom 15%. You are at this bottom 25-30%. So likewise, depending upon where do you stand, you need to assess yourself, and then you have to train yourself gradually.